All right.
Hi, everybody. Thank you so much for joining us. We're about a week late. We appreciate your patience. As luck would have it, during a pandemic, sometimes people get sick, and sometimes those are the people who we need the most with our technical difficulties. So thanks for your patience. One of the good things is during that time is more and more questions were able to come in from our staff and community members, including the It Takes a Village Coalition. So we will be able to address some of those questions here today. This particular public information session, we are going to be talking about the testing initiative in the district. I know people have a lot of questions about coming back to school in person, and they have a lot of questions about mitigation strategies, but we'll be addressing those in a different information session. Today, we are just going to be talking about the testing. And actually, this particular group that you're looking at, we get together every week to discuss this initiative and how we can utilize testing as a way to keep our communities safe. So this is a weekly meeting, and we just decided, hey, let's make it public so that people can get a view for the conversation and the different entities involved. So I'm Erin Graham. I do communications for the Lorain City Schools. And folks, I'm going to ask that you introduce yourselves. Jeff, if you could perhaps start with us.
Sure. I'm Jeff Graham. I'm the superintendent of Lorain City Schools.
Ross, you're next on my screen.
Yeah, hi everybody. My name is Ross May. I'm the Executive Director of Strategic Planning, Data, and Process for Lorain City Schools.
Jeff Kay.
I'm Jeff Karuski, Executive Director for the Family Office, and I oversee the nurses that are doing the testing.
And then we'll go down to Katie.
Hi there, I'm Katie Malier. I'm a nurse practitioner with Mercy Health Physicians, and I run a clinic in Washington Elementary for the Lorain City Schools.
Thank you. Dave?
Hi, I'm Dave Colville. I'm the Health Commissioner for Lorain County Public Health.
And then up top, Tim.
I'm Tim Williams. I'm a member of the Lorain City School Board of Education.
And Prakash.
I am Prakash Ganesh. I'm a physician and assistant professor at the Case Western School of Medicine.
Now, see, Prakash, I actually saved you for last because you had the longest title, and you only gave us a smidgen of it. So
I thought I would introduce what was important, but I'm a public health and family physician. I have an assistant professorship in the Department of Family Medicine and Community Health at Case Western Reserve University School of Medicine, where I also help run a residency in public health and preventive medicine. And I also see patients at neighborhood family practice here in Cleveland as a staff physician.
thank you. And thank you everybody for being here on this call today so that we can share out with our staff, our students, our families, our community. So that our viewers know what to expect, we have specific questions or specific topics that we know are top of mind, which we are going to be addressing. And then from time to time, I'm going to be dropping into the chat some of the questions that we've received via email or through social media from all of you. Can we start out with, Jeff, Dr. Graham, can you talk a little bit about why testing? Why are we doing this?
It's a great question. And it's candidly, when we were trying to figure out a plan to come back to school, we knew there's more information that we needed, excuse me, but didn't know what we needed, candidly. Reached out to Dave Colville and said, Dave, we'd like to gather some more information. You know, is the state has broken down by county, and we have the yellow, orange, red, and purple designations based on a number of factors, including positivity rate. And we knew that information was important, but we also knew that the information that came by county didn't really give us information about what was happening in the Lorain City Schools community. County borders are pretty arbitrary, and we also know that people of color and people of poverty are significantly more likely to catch the virus, spread it, be hospitalized from it, and die from it. So we wanted to make sure that we were being as careful as we could in all aspects of what we were trying to do. So reached out to Dave Colville and said, look, we want to investigate this deeper. And he said, I'm in. Reached out to Ed Oley from Mercy Health, and he said, we're in. And we just started having conversations. And we went down a number of paths because candidly, we were trying to figure out not only what information we needed, but the best way to gather that. And what we landed on was to randomly test our students and our adults to find out what is going on in our schools and project it into our community. And the purpose of that is twofold. One is to make sure that if there is a positive case, that we're notifying people as soon as we can so they can behave in a way that is safer and reduce spread. Especially in our homes where we have many multi-generational families. But the second part of that was to assess the quality of our mitigation strategies. We need to make sure that if a student or an adult comes to school with COVID, no one else catches it. And if we do things the right way, that's exactly what should happen. So we had that partnership. We were working on doing randomly testing. We had a number of adults and our students and our families said that they were willing to do that. And as we were started to solidify that relationship, candidly, by accident, Ross stumbled across Prakash, who was looking to do this research, exactly what we're trying to do through Case Western School of Medicine. So it was a partnership that it's exactly in line with what we want to do. We bring expertise, additional expertise to the table, as well as some other resources. So I think the goal has been and continues to be making sure that we keep the people of Lorain safe.
And I'm going to drop just a couple questions into the chat, but please, for everybody, just because I'm addressing a question to a specific person, please chime in at anytime. I see this as a discussion. So if you have things to add, then please do. So two of the questions that we've been getting are these results going to be reported to insurance? Who gets access to what information? And what will be done with that, with the data that's collected? And also, like, is it possible that the results of these tests can in the future be seen as like a pre-existing condition that could come back to haunt them?
So I'll start with on the data side of things, what will we use the data for? And as Dr. Graham said, initially when we were trying to figure out ways that we can safely bring our students and our staff back, it was just really important for us to know how effective our mitigation practices are. The last thing we want to do is contribute to spread of the virus. And so a really important part of our process was to make sure that we can use data to inform us about how effective our mitigation practices are as part of our back to school process. So the data is going to be extremely important that we look at the incidence rate. So how many people have an active case of the virus at any point in time. And then to look at the contact tracing in partnership with Dave and the health department to see where is that virus transmitting. And if we see that it's transmitting through us, we've got to make immediate adjustments. And that's where having an active incidence rate and the contact tracing is going to be extremely beneficial for us. If it's not transmitting through the school environment, then we're feeling pretty good about the mitigation practices that we have in place. So the data is going to be really important to let us know just how safe an environment is that we've created. And when we have cases, how do we need to adjust, if we need to adjust based on what that data tells us.
And go ahead, Dave.
So I can address a little bit on once a positive case is identified, then it drops into what's called the Ohio disease reporting system, and it allows us to do our contact trace, work with the school to kind of make sure that any close contacts are quarantined so that it doesn't spread in the school. And so that's kind of a defense mechanism, if you will, that's been set up to try to help one individual case from becoming multiple cases inside of a school. So that's kind of where we come into play with any positive case that comes in. And again, that's HIPAA protected information. So those staff members or school individual or children that come back positive, we're really doing that contact trace around that and taking care of that. And it is as quiet of a way as we can, if you will, in terms of people's medical scenario.
And Aaron, I would just add also to build off Ross and Dave, for our purposes, we would just be helping help look at the incidence rates of new cases that we're seeing within the school and where they're happening, but also all this information would be de-identified from our end. We wouldn't see or know any identifiable information.
And I think that's key. What we're hearing a lot is, or what we're trying to address a lot is there's these different stages to the testing. The first was to test our student athletes so that we could, determine safety of getting them into tryouts and practices and in different activities. And then there is this other body of testing that would be done and extended into our schools of our staff members and our students so that we can get an idea of what that spread is or is not happening. And that's where a lot of your work is going to be, I see, Prakash. But there's a lot of confusion. So here, let me drop this question in.
And so I think also, if I could add, because I think we've spoken to what the data is used for. I think the other inverse question is what the data is not being used for. So this is not going to anyone to do any marketing. There is no third, fourth, fifth parties who gather this information for personal or corporate agendas or anything like that. So we're not part of some study that uses our information for profiteering or anything of that nature. Nor are we part of any experiment of COVID testing. So we want people to be sure about those things. We're very pleased with what this is being used for to support our information and our community health. But also that people are aware is we are not using this. This information isn't being sold. It isn't being given away to anyone other than the entities that are part of the partnership.
And I'm so glad that you said that, because one of the questions that we continue to get, and one I dropped into the chat, one of the reasons that we're able to do this is because we had funding. We had an anonymous donor who was able to kickstart this initiative for us. We've had other donations since then, but they've asked, one at least has asked to remain anonymous. And so one of the questions is, who are these mysterious backers? Why are they insisting on being private? What are they gaining by getting, this information about our population? Why us? And let's be real. I mean, these are legitimate concerns. Historically, minority populations have been subject to testing in the past, and was very detrimental to, the health of just untold numbers of people. So we understand that this is a real concern. How can we address that for our community?
I'll jump in there real quick. In terms of the mysterious donor, it's not, excuse me, not mysterious, but they did ask for anonymity. I don't know why, but it's a business in the city of Lorain who donates to many causes. And my guess is because of COVID, they've been limited. So they had they donated $200,000 to the schools. And candidly, we could have done a number of things with it. They didn't restrict us to this. But they did need to approve what we were doing. And we saw this candidly as one of our biggest issues. Again, our goal is to keep people safe. We saw that as a top priority. And this allowed us to do it in a way that was keeping people safe while being respectful to our taxpayers. Since that time, since that initial $200,000, the city has given us $150,000 through CARES Act funds, which are governmental dollars that can be targeted to these types of activities. So they're actually very limited on what you can spend that money on. So it just worked out very well for us. But the business, the company that donated the first $200,000 will not get access to any of this information or data. They just donated money.
And again, if I could just reinforce what Dr. Graham is saying, when we started this project, we knew the importance of it, but we were not sure as to how we were going to be able to actually fund it. Our priority was this was so important that if it had to be a general fund expense, we would figure out how to do that. So there was no correlation between us starting this and the anonymous donor. That was more of a fortunate opportunity that occurred. And so, and it is not unusual that we have donors who are anonymous for many reasons. Some donors, they have to deal with, they've given a very generous gift to one district. And then when that's made aware, there are going to be every other district who would be seeking them out. So there are lots of reasons why folks like to remain anonymous with their generosity. What we make sure is the integrity of it. is it comes from a reputable business, that there's nothing nefarious about that, and that there are no agendas, there are no quid pro quos, there's nothing that is attached to this money. In fact, this money had not even been identified specifically to be utilized in a certain area. So again, we thank the donor and we respect their desire to remain anonymous.
Coupled with that, there are just certain things that we couldn't speak out on because there are so many different partners, and so many different partners have to approve various levels of language and procedures, and et cetera. And I think having a university partner on this has created some additional confusion. But Prakash, if you could speak just a little bit about the focus of your work and why it makes sense to do that work here in Lorain.
Yeah, there is a lot of talk right now, especially within the medical community and school community, about what is the safest way to go back to school. A lot of people are talking about implementing testing strategies into their reopening plans, but they don't have the resources to do so. So I think Lorain City, the school leadership was a lot more forward thinking in wanting to implement that, but then also had the resources available to actually implement this, which a lot of school districts would like to do, but just can't. And our goal with this initiative was primarily to show that frequent testing is an essential pillar to school reopening. This would help direct mitigation strategies, locate problem areas, and allow for an effective response from the public health department and the school. Our hope was just to provide some expertise in looking at the research behind it to be able to direct how the data collection is being done, report effectively, and create generalizable knowledge for the community, for other school districts, for other counties, hopefully the state or other places around the country to direct this, because currently the CDC notes that such testing could be helpful, but hasn't been systematically studied. So there is a lack of literature to back up the recommendation for testing within schools from the CDC.
So your role will be to take what we've learned from this process and share it with others to make our small little community experience helpful to a broader knowledge base.
Along with you guys, of course, and to help our partners here around the table to do that.
And Ross, it looked like you were about to chime in. Am I misreading you?
Well, I was just agreeing with everything Prakash said, that first and foremost, we want to make sure our families are safe, and our hypothesis is that a testing and tracing as part of our mitigation is vital. And then along the way, if whatever we learn helps others, perfect. And we really appreciate having Dave and Prakash and Katie and Shar from Mercy to help us, because none of us are experts, in this type of thing. But Dave and Katie and Prakash and Shar are. So we just so appreciate their collaboration with us to help us design this, and then to be able to communicate what we learn with others that can benefit as well.
And Ross, you are widely seen as like the data guy within our administrative team. And thank you for your leadership in bringing all of these parties together every week to make sure that we're continuing to move forward on this. And just real quick, I'd like to, because there was a sound bite, and this is for everyone, there was a sound bite at a board meeting about how cases involvement would be testing for, I want to say 19 different things. And that got a lot of people nervous. My understanding is that that component has changed. Can we address that to ease concerns?
Yeah, so our plan right now is to use, so we're being helped through a grant through the School of Medicine here at Case Western. And we are primarily going to use that funding to help support the testing that's already in place with Mercy Health. So we would help support what Lorain City Schools is doing with Mercy, and no samples will be taken to Case Western at this point. So everything will remain in Lorain.
And one of the questions from our community is, or a staff member, what are the transactional costs and benefits with our research partnership with CASE?
Yeah, so go ahead.
Oh, please, go ahead.
So this grant would be coming through CASE. They support a lot of, this is through our translational center. So they support a lot of research, especially right now into COVID. And it doesn't have to be primarily like benchtop research where you think about somebody sitting in a lab pipetting different chemicals. We're primarily looking at how this is impacting our community. It's kind of a real life scenario. And we're not trying to use any new testing modalities or medications. We're using the gold standard right now, which is the COVID-19 PCR testing, which is testing for the genetic material of COVID-19 within each sample. And our partnership would primarily be bringing our expertise to help with the direct data collection, the mitigation strategies, and then helping with the research methods to assist our partners here.
If I could elaborate just for a second, and I talked about how these partnerships came together, and when it was Mercy and Lorain Health Department, and we went down, we were talking about this for weeks. We went down a couple of rabbit holes that just, I mean, we worked with House State research team. We looked at a research team out of some folks in Baltimore, but some of those things just didn't quite pan out. So this has evolved over time. To Ross's point earlier, none of us have any idea what we're doing. These are new times. So once we solidified our plan, which was to test our students randomly and our adults randomly to a point where we could project on the total school population with 95% accuracy, 5% error, what's going on, as well as assess our mitigation strategies. Those are the critical pieces. But again, they changed through time. And then once we stumbled across CASE, and they want to do the exact same thing we were doing, but they had some different ideas too. And it started out that they were going to do some of their own testing with our students in close proximity activities. That just changed. So some things that we've looked at and as this has evolved, we just determined more efficient and productive ways to work together. So there was a time when they were going to do testing. And if they would have done the testing right now, Mercy does the nasal swab, and it's a thumbs up or thumbs down, whether it's someone has COVID. And if CASE was going to do the lab work, they were going to test for a number of things. Most of it's all cold and flu and that type of thing, just to assess if COVID spread at the same rate as the flu or in the same ways as the flu. So again, it would have been great research to have, but again, we are now just doing Mercy testing, only COVID testing. And again, our relationship has changed to make sure that, again, our goal is to keep people safe. And this is, in our minds, the best way to do it.
So again, that component is no longer happening. We are only testing in one way. Can our health professionals talk briefly about that test, that PCR test, what it does tell us, what it does not tell us, and how it is administered? One of my jobs, one of the committees that I'm on, is educating people about the test in and of itself. And so we have a video that we'll be releasing. But we'd really like to be able to share now for folks what it's like, what it does and what it doesn't do.
Well, I can start, and then Katie can talk about the process, which is not my expertise. That's my suggestion to you is that the big key to us is that it's a PCR test. It's a more accurate, it's a confirmatory test to confirm that you have COVID-19. So
meaning an active case right now, correct?
Yes, it's an active case right now. So let's talk about the three types of testing that are most commonly discussed, and that is antibody testing, which says that your body was exposed to this virus at some point. And that tells you that maybe months ago you had it. And so if you give blood, you can get that antibody test. And there's other antibody tests out there that just say if you've ever been exposed. Then there's what's called an antigen test. These are kind of the walk-up instant tests. These are a little less accurate. We get some false positives and false negatives. We don't really recommend them. I laugh a little bit and compare them to instant soup. They're quick, but not nearly as tasty as good as regular soup. And then there's the PCR test, which is the gold standard. Now they do have a more rapid PCR and a more one that takes a little longer, but both are very accurate in terms of, do you currently have the virus and could you currently shed it right now? So then when those come back positive, that's when we do a contact trace and kind of try to make sure that people go home, stay isolated for 10 days and 24 hours asymptomatic so you don't spread it to anybody else. And then we quarantine around that to make sure that we have a ring around that person so that it doesn't spread. And so anyway, that's why the PCR test is so important. As far as the process of how that test is acquired, I'm going to turn it over to a nurse practitioner who clearly knows how to do that a lot better than I do. So take it away, Katie.
And good morning, everyone. So the test is fairly simple. The test that we do, that we're currently doing, is called an anterior nares swab. I think that there's been a lot of misinformation on this on social media. The test that we're doing is a quick, right here up to the anterior nose. We're not doing a deep brain probe that most people, are afraid of or whatever. So anyways, it's a quick, swab of the nose, and it gets sent to, we collect that sample. We're doing that oftentimes from the vehicle, depending on case by case. It's sent over to Mercy Lab, who prepares the sample to be sent to LabCorp running our tests. The turnaround time is 3 to 5 days. Most of the time they're coming back early. So I'm telling people usually 2 or 3 days on those results. Test results come to me, I'm the ordering provider. And then information is protected and sent out on a need to know basis. So.
Aaron, you're muted.
Thank you. Our youngest kids needed to have the COVID test because they were sick, and my parents live with us. And when Katie administered the test, like there's no poker face with these dudes. They are young, they're air ticklish, they're sensitive, they're dramatic. And when she performed the test, they agreed that it wasn't painful. They said it was weird and it's itchy because you're being touched in a part of your nose that you've just never really touched before. So thank you for your gentleness with them on that. And you alluded a little bit to the process and like the workflow that we're using with the student athlete testing. Can someone speak to why we're starting with our student athletes and how that process is going?
Aaron, I can speak to the process. The process is our student athletes fill out a consent form. They go to to our testing location, which is the field house currently, but we are also adding an additional site over at Southview Middle School. Children come in, we write an order at the time. When they walk in the door, they are sanitized. All individuals in the room are dressed in appropriate PPE. It takes about 5 minutes to come in. They confirm that the child being tested, we go through specific steps to confirm accuracy. Once that is complete, they do the swab, as Katie stated, just a quick 5 turns around, put it in a vial. The vial is closed. The child is escorted in and out of the facility in no direct contact with any other children. So we are following specific protocols to make that happen.
And to answer the question why we chose to start this way, and it's not just athletes, it's any student who's participating in a close proximity activity. For example, robotics, when we get started with robotics, obviously wrestling, basketball, band, if you're going to be in the school play, anytime we're encouraging students to behave in a way that's inconsistent with what the CDC expects from us, whenever we're not behaving in a socially appropriate way based on COVID. So, and again, I just want to stress the fact this doesn't protect them from getting the virus, but it allows us to act and react more quickly when they do. So again, our goal is to keep people safe. Can't keep people safe when they're wrestling, but we can react quickly when the virus spreads.
a question that we are getting from our parents a lot is, okay, here's a mom. My question is this. My son and his teammates may be getting tested weekly to be eligible to play, but what about their opponents?
And Prakash, and I think you mentioned this earlier, that a lot of schools, for a whole lot of reasons, aren't able to do what we're doing. So I think we have to assume that they are not being tested.
And
And the
so
question also comes up with coaches too, that our coaches are voluntary, but our coaches are behaving in a way that is socially appropriate. Our coaches wear masks. They stay 6 feet away from our athletes. So they can still do it. And most of our coaches, many of our coaches are getting tested, but it's not necessary because, again, they're not behaving in a way that's inconsistent with what the CDC expects.
So I think the point that's being made here is it safe for my student to be competing against other communities?
No.
So, yeah, let me kind of address that a little bit. Yes, you're right. And I think Jeff's point is well taken, that many school districts just can't do this. And so some are not, and they're more testing if someone's symptomatic, then they'll get them, then they'll be tested, and we'll find out later after the fact that that there was an exposure. And unfortunately, it does increase your risk. Your child playing basketball is going to increase your risk. Just statistically, you know that there are some people that may end up coming back positive. And if that's the case, you may have an exposure. And those are decisions for each family to make. Is this risk enough where it's an issue? And so things that might play into that are a couple things. First, you know that your high school child is probably not going to have too bad of symptoms. Most kids don't have too bad of symptoms. It's really more they can bring it home. And they bring it home to, as Jeff mentioned at the beginning, multi-generational family members. So you could have grandparents, aunts or uncles that maybe have, or even parents that have maybe an underlying health condition. And so those are risks that you've got to be weighing when you're talking about this when it comes to playing. And the reason is not because necessarily the child will have a bad health outcome, but that they may bring it back. And so you're right, there is no way to be sure that the other kids they're playing against aren't positive at the time you're playing. Once a positive case comes back, then there'll actually be some quarantines around there. And in a basketball scenario, if they're playing with a child who comes, or with a student who comes back positive, most likely the teams will all be quarantined around that, because basketball is one of those sports that it's really hard to control. And again, the main thing I think parents need to be thinking about is, yes, it increases the risk for the child. The question is, is that risk worth it? And more importantly, is that child then going to be isolated from other more high-risk people in the family? Because that'll be a really important piece.
And if I could add, from our board governance perspective, this information is very helpful in terms of how we then respond. We work closely with our administration and with the partners. And, a lot of folks are alarmed, I'm sure, because they look at Lorain and they look at neighboring communities. If you look at Cuyahoga County right now, it's about as red as you can be before you're purple. And so we're always making informed decisions on competition with other folks based on our testing, based on how our athletes are doing. And then also we're always factoring in what's happening in the communities around us. So when decisions are made, it gives us a lot more information to make those decisions on. And we're always trying to make sometimes what seems to be the best of bad decisions. This is not a good time, but the more information we have, the more rigor we bring to our process. And it also helps us to make sure our kids are doing the other right things. They know they're being tested, so they're encouraged to wear their masks. They're encouraged to behave certain ways outside of practice. So what we believe is, by being this attentive to our proactive things, it reinforces the behaviors they need to have outside of sports. And what we're hoping is all these communities of other districts who are not able to test, that they're using good, strong behavior in terms of wearing masks, social distancing. And again, athletes want to compete, so they all know that during my season, I really got to be vigilant about my behavior. So that's what we're hoping. And we're trying to reinforce that information throughout our entire community, not just the athletes who are being tested.
Tim, or to all of you, has any indication been made by OHSSA, et cetera? So say you're a senior and you were, a top athlete on the football team, but we didn't have a football season. You were likely going to be getting some good scholarships, and that would enable you to be able to go to college because you needed that kind of financial support. If your district did not have that sport, or if you don't participate because of other dangers to the people who are at home, do they look at a different year to look at scholarships? Do they, a lot of people have asked that question about involvement.
Yes, a couple things there for athletics. And do scouts and coaches and universities look at previous years? Yeah, I know a lot of students who've gotten scholarships and didn't play their senior years because they were hurt. I mean, there's a lot of evidence to that. That being said, our goal is, and I'm very optimistic that we're gonna have football in the spring. The governor and OHSAA has allowed it, and Brian Corey's working very hard to make that happen. So our our fall sports can be played in the spring, and our goal is for that to happen.
Great. And a lot of people too are saying, okay, so my child is in remote learning at home and is exhibiting symptoms. I can't get into the doctor because all the doctor's offices are so backed up right now. Katie, can you talk a little bit about your clinic, how our families can contact you, get an appointment, what services you provide, et cetera?
Absolutely. So our clinic here at Washington Elementary, we're at Washington Elementary, and we are open 5 days a week, Monday through Friday, 7:30 to 4. And we are providing all of the services that, any of the other Mercy Health physician offices would provide. We're doing sports physicals, we're doing well visits, we have immunizations available as needed. We have all kinds of point of care testing. So for, cold and flu symptoms, which I know is very difficult in this climate, everything is a symptom of everything. So we're able to tease that out. We also do UTIs, well women care. We care for the whole family, not just the students.
Important,
so that's an important piece as well. So, and we also do have COVID testing as needed. So if anybody is in need of any services, give us a call. It's 440-370-5446.
And your clinic is seeing patients, is it between 8 and 2, Monday through Friday? So they can call, make an appointment, and from what I've been hearing, you've been able to get people right in.
That's true. That's true. Yes. 7:30, 8 o'clock till we're here till about 4 o'clock.
Okay.
The other piece I forgot to mention, Erin, is if folks are not comfortable actually coming into the clinic, we have a service available where we can do it's called a virtual visit. And it's almost like FaceTiming, but it's through a particular program that is safe to share medical information, so it's protected. The program is called Doxy, and how that works, if you call the office at that phone number, you speak with my medical assistant, she'll set you up for that virtual appointment, and I text you a link to your smartphone. You click on that link and you enter my virtual waiting room, and we can do the visit over the computer. So that's another option for families as well.
And so our families can utilize your clinic, our staff members can utilize your clinic, is my understanding. And hey, the virtual visit seems so key too. So if you are at home with your children who are in remote learning and it's not feasible to just leave and go for a doctor's visit, that virtual visit would be just a great option.
Absolutely, it's very convenient, and we can do most things over the computer. So
yeah. Hey, if we can teach over the computer, certainly we can have health visits over our computers.
That's right. That's right.
I want to move into the next phase of our testing, which is going to be the expanded testing. But first, can we address, people are saying, So at the beginning of the year, here's where, cases were in Lorain County, and we were as closed as we could be. And now we're talking about, winter sports. We're talking about coming back to school in person as one of our parent choice options of phase 2. But cases continue to rise, and hospitalizations are on the incline. Why now? Why are we talking about coming in person and being more in close contact with these circumstances?
To take a step back as to why we didn't start school in person and we started full remote for a couple reasons. Our leadership team was established in the middle of the summer. We quickly reached out to our community and asked their level of comfort with sending their children. It was very clear they were not going to send their children to school. And if there was a positive case in the district, then those who were going to were going to take their kids out. And we knew there'd be a positive case. So we knew there was an education piece to that. We surveyed our staff and worked with our staff and listened to our staff as well. And they said that we're not ready. And candidly, it didn't take long once we looked under the hood, we weren't ready. We couldn't keep people safe. Now, and again, you look around the computer screen at all the experts we have, and I'm not one of them. I do what I'm told when it comes to COVID and making sure that folks are where they're supposed to be and doing the right things. But we can keep people safe now. And as I mentioned earlier, if somebody comes into our schools COVID positive, no one else should catch it if we're doing the right things. And we have a lot of folks working with us and holding our hands as well as looking over our shoulders to make sure that happens. So I do feel much more comfortable now than I would have during August. Ross, did you want to add to that?
Well, and I was going to ask actually Dave and Prakash to chime in here on this as well. So to add to what Jeff said, we've had groups working to design our environment to make sure that we're safe. So from arrival to dismissal, how we space students out in the classrooms, how office works, how the lunch works. So we've been really intentional about designing our environments. And then one of the things that we've learned along the way here, and Dave and Prakash, please hop in on this, is that just through the contact tracing that's been happening other places, it doesn't sound like there's been a lot of school-wide spread to this point. So while virus is obviously spreading, it doesn't appear at this point that school is the main driver for that. But I want Dave and Prakash invite you guys in to talk more about that.
Sure, I can give you kind of a perspective. At the beginning, we weren't exactly sure what would happen when schools opened. We were worried to be an amplifier where kids would start spreading it in school and then bring it home to more high-risk folks. And so that was a real concern. And so what we learned early on in the summertime when late spring and early summer, when businesses started to reopen, if they did a nice job of following all the rules, 6 feet, wash your hands, wear a mask, that didn't spread in their businesses. And so we applied those same techniques to school settings, and that's where a lot of the guidance came out for schools. And so far, what we found is, you're right, it's not spreading in school once it gets there. Now, it doesn't mean that asymptomatic kids aren't bringing it home or that they might bring it to school, because again, it's in the community everywhere. And so this idea that you would never have one in a school is just unrealistic. But when it comes to school, is it spread to the kids next to them, the kids, throughout the rest of the school? And so far, we have not seen that. Again, I'll take this opportunity to stress this one fact. Just because school opens doesn't mean kids should be hanging out and doing sleepovers and all the other things that make us feel better. Those issues, and around the holidays, those issues will continue. Those issues are where we're finding the spread. It's not actually in the classroom. And so if you design it right, you can stop it from spreading in the school. But it still will be important to emphasize with kids that doesn't mean just because school opened, that doesn't mean you can be more casual in a more casual setting. And that is where we are seeing the amplification going on right now.
And I think as we look at some stage in the future, near future, hopefully whenever it is, resuming school, our confidence, our expectation is that while kids are in school, while adults are in school, that they follow all the rules. I think when from a governance perspective, looking forward, it's how do we effectively have folks comply? We don't like to look at how do we enforce rules, but how do we encourage compliance? Those are different philosophical approaches that hopefully get us to the same outcome, which is everyone doing what they need to do. So parents who are watching this, if and when your kids return to school, teachers, if and when you return, staff, if and when you return, be prepared to comply with all of the guidelines that are in place. As Dave has said, what's imperative is that everyone follows these guidelines. What makes the spread not occur in schools is because during those 6 hours of the day, people are wearing masks and social distancing. If you do not do that, then they would be absolutely right. We have created a spread machine. So we expect that when we return to school, that all adults, all children, everyone who is in one of our buildings is compliant. And I think if we respect each other's safety and health and take care of each other, then we can do this successfully.
And soon, the Lorain City Schools will be releasing a video and an explanation of all of the mitigation strategies that will be employed in our schools, how our schools will be set up with social distancing, masks, etc. But like the role of, and so we'll be talking about that in a future public information session, all the little nitty gritties of that. But Ross, can you speak to the role of testing within that? Can you talk about the randomization that will be occurring, procedures that have been determined so far?
Mm-hmm. Yeah, so we said it, as Dr. Graham said at the outset, we wanted to make sure that testing was a part of our approach to make sure that we're not contributing to spread. And when we have cases, we can respond very quickly to make adjustments. And so the challenge was to figure out, how do we do this in a mathematically appropriate way where we don't have to test everybody every day, but that we can get a good sample that lets us know what the incidence looks like. So there's a formula you use to figure that out. And the short of it is that we're going to randomly test across the district, depending on the number of students that choose in-person learning, probably between 300 and 350 students per week. Per week seem to make the most sense for us because it seems that most cases show themselves, I guess, within that first week, and if not within a second week. So by doing a weekly approach, we can have a pretty confident read of the incidence rate. When we test between 300 and 350 students, we've got a really good sample across the district that lets us know, as Dr. Graham referenced before, with 95% confidence, how accurate that is of spread. And then with the staff are part of the community as well, the school community. And so we had some initial discussion, do we only look at this from a student perspective? But we just really believe that it made most sense to look at it from a staff perspective as well. So to do this, all of our students will be assigned a number, and we're going to use a random number generator. So a computer is going to just pick numbers at random, and those will be the students that get selected for that test the following week. We're going to do the same thing with staff. Staff will all be assigned a number, those who choose to participate. Again, there'll be a random number generator. For staff, they'll have connected to our website just a list of numbers that were picked. So there'll be no identifying information that goes out. There'll be no emails to trace or anything like that. So our staff will just go to the website and get their number, and then they'll know that the following week that it'd be their turn to test. They'll schedule an appointment at the testing site with the nurse, so it's a time convenient around them. And then for our students, the week prior, we're going to send a letter home with the student, and then they'll also get a phone call letting them know that their child's date and time to test. And so by doing it randomly, it's really important that we are doing it randomly, because that's going to give us the best look at what the actual incidence looks like. If we just did a certain group of students over and over and over again, that wouldn't give us a very clear picture of what possible spread looks like. This does mean that there could be some students or staff that get picked multiple times, and others don't ever get picked. That's just part of randomizing. So everybody has the same chance of getting picked every single week. It's not like just because you got picked once that you're not going to get picked again. But by doing it randomly, it lets us have as clear a look as possible of what the incidence rate looks like without us having to test every single person every single week.
So I guess the natural question that comes off of that is, okay, so we have this information, now what? Like, what do we do with it? Now that we know what the incidence level looks like, how do we parlay that information into something usable?
Yeah, and there are multiple layers to that. And so let's start maybe with the individual student layer and and staff layer and what happens, and walk through those steps, and then we can take it to a systems level. So what if Katie, do you mind walking through, so from the time that the test comes back from Mercy, we've got some positive cases, negative cases. Do you mind walking through what happens when we get positive cases?
Not at all. So, so the test goes to the lab reports back to me the results. The positive cases are automatically sent to Dave's office, the Lorain County Health Department. So my intention is to call the families. You receive a call from me that your results are positive. I give some recommendations and tell the families that they'll be to anticipate a call from the Lorain County Health Department. Negative tests. So negative tests, they are reported to, they receive a phone call and an email, and they're directed to a website for further information regarding their results.
And then Dave, on your end, then can you take us through those next steps? So the family's notified of the positive test from Katie, you're notified. Can you take us through those next steps about how that data flows through you then?
Sure. All cases, including these, get dumped into our disease reporting system. And then within 24 hours, our contact tracers reach out to that case. And they ask things like, how are you? How you're feeling? How are your symptoms? And that kind of thing. And then also 48 hours prior to the test or prior to them becoming symptomatic, they'll look at any close contacts so that we can determine, because again, you can shed the virus, you probably have heard this before, that you can shed it asymptomatically. It's really pre-symptomatic. It's right before you start to show symptoms. And so about 48 hours prior to that test coming back positive or prior to the symptoms, we'll do a little contact trace and find out who were close contacts and what those look like. Now, usually those are people from their family, obviously, because they live with them. But then as long as the school is designed right, and as Tim mentioned, people are following the rules, most likely there won't be a close contact inside the school unless someone is having lunch with someone or something like that, and or not following the rules. And then those might be a close contact. Other things might be outside of school, where they may, hang out with someone at some point. And so anyway, so those are identified, and then those folks are quarantined. The case themselves has to go 10 days and 24 hours of asymptomatic. In other words, no more symptoms for 24 hours, but you still have to wait 10 full days, because that's how long it takes before the virus can't be shed any longer. And then once that's done, they can come back, and then they will not be a danger to shedding it anymore. And so that's kind of how that happens. And that all happens within 24 hours of when the lab drops. Now, the one difference, and this is where Katie and I talked earlier, is the reason it's good for Katie to reach out right away is because sometimes the lab takes a little while, maybe a day or so, to drop in our system. So we don't want people to they find the result and, oh my goodness, what's going to happen? So that's why it's really important for Katie to also reach out to say, this is the situation, the health department will be calling. So again, that helps with people worrying unnecessarily. So that's the scoop. That's how that. Now, negative people, we do not contact at all. So just so you know that.
And then Prakash, let's maybe bring you into the conversation there, and at a system level then as well. So as a group then, we're going to be looking at the incidence rate. So can you kind of talk through just the importance of us like monitoring that incidence rate, and not the individual student or staff members, but to help us make decisions about our mitigation practices?
Yeah, so we would work closely with Ross and his team, and of course with Dave and his team, and look at specifically how where we're seeing our cases rise or not rise. And so we can help direct our mitigation strategies and look at ways to improve them or enhance them, or see what is pushing new cases to be developing in certain areas. And so we would work together with all the folks at the table to see how best to react to a certain rise in numbers if we see that.
And Ross, as you have been working with like our operations department and our principals to get our buildings ready for in-person learning, as I understand it, like you've had the health department through, you've had Prakash walking through, like you've had a lot of folks take a look at what we're doing to guide our efforts.
Yeah, we have a number of work groups, and one of those work groups has been to get our schools set up, and we set up 5 schools to be model schools and to set up for distancing in the classroom and arrival and dismissal and sanitization practices and airflow, and we have shields in the offices. And so that's been a really great effort. We had our phase 2 planning group walk through one of our model schools and provide feedback. And so we made some adjustments. We had our principals walk through and provide feedback and make some adjustments. We had Dave on a Zoom when we were walking through the one day. Prakash came through our high school last week when he was out to walk through. So, it's just so important to us that we try to do the absolute best we can to keep people as safe as possible, to make sure that we're mindful of everything to the best of our ability, to make sure that we can keep people as safe as possible.
Including touring some of our neighboring school districts who went back in person, correct?
Yeah, thanks for that reminder. And yeah, so we visited 7 districts that are in the area and looked at their practices, learned from them. We kind of went shopping for practices, and that was extremely valuable for us to look at how their schools were set up, how they designed their instruction to be in a safe environment. And so that was really an important piece of our process to get us started a few weeks ago, just because we know that there are a number of other districts that have been at this for a while already, and let's learn together, with them. So we had a number of folks go out to those 7 districts and just learn from them to see what we can bring back and apply to us.
And I dropped a couple more questions into the chat. And to be honest, since I don't sit on every committee, I don't know if we have these answers yet. But for instance, will participation in the testing itself be mandatory for students and or staff?
No, and we were there for a while as we talked this through, especially with staff and students who were willing to come back. We had a number of students who volunteered, a number of staff who volunteered, who said they would be willing to volunteer. And when we ran it by Prakash to find out what we needed to do, the numbers were high enough I won't speak for you, Prakash, but I thought you felt comfortable that even though it wasn't a full random sample, because some people would choose not to be tested, the numbers were high enough that we would be able to project onto the entire school population with confidence.
And so for right now, we have staff members who might be getting COVID tests outside of this testing effort. And when they test positive, there's a process that is being followed, a workflow. So the question here is, why do some buildings close when a staff member tests positive and others do not?
So I guess I can address that. So I assume that means, in other school districts mostly, but, in terms of what people hear on the news and things like that. So a couple things. So let's say someone tests positive on a bus, right? They're test positive, they ride a bus, they're in a particular area of the bus. This is why it's important this year, not only in the classroom, but on a bus, that kids are in the same seat all the time. Like we always say, we want kids to find new friends and do all that. Well, this is probably the year where they're a little cliquey and kind of stay with the same friend group, because again, we want to make sure we cohort a little bit to make sure that exposure is limited. So in that case, we may have 1 or 2 exposures on a particular bus. It would be very unlikely we'd quarantine an entire bus because one child came back positive. Same thing in a classroom. If you're in a classroom, and again, people are following the rules, they're staying 6 feet apart, they're wearing a mask, they're washing their hands. Most likely, other people in that classroom will not need to be quarantined. It may be 1 or 2 that they may have lunch with, or some other scenario that might be unique. But again, if people are following the rules, you won't have that problem. Where you do have scenarios sometimes is some school districts opened and they put in their policy that if they have more than one positive, they're going to close the whole school. Again, statistically, let's think about this a little bit. So if you have one child comes into a classroom and they're positive, and then a month later, a child comes into another classroom and they're positive. A week later, another classroom, they're positive. You can assume that that's going to happen because of how the community spread occurs. Where you might have a problem is you have one child comes in and positive in a classroom. 4 days later, you now have 2 children in that classroom. And 4 days after that, you now have 7 kids in that classroom. So what you can see the difference there. That means it's spreading in the classroom. That might be a scenario where you're closing that classroom, maybe the school building, depending on the situation. And so that's the difference between case number, right, and the unique scenario around case number. That if you had 5 cases in an entire building or an entire district, it wouldn't mean much. But if you had 5 in the same classroom, that's a different story. And so each of those are handled, which is why we do the case contact tracing, so we can actually see if it's moving in the school. And so that's where you would have a closure scenario, you know, in a classroom or a school or whatever that might look like.
Yeah, we get a lot of questions about contact tracing. And, you know, our party line is pretty much, well, we do what, you know, the health department tells us to do, because we are not the experts. The health department, they are the experts. Jeff, do you have anything you want to add to that? Because I know you get that question a lot.
I get that question a lot. And yeah, I do what Dave tells me to do. It's pretty much my line. I think our role in contact tracing, and I think there's confusion because of the testing piece. And with the testing, the only thing the schools are doing is allowing for it to take place at our schools and supporting the activity and then obviously paying for it. But when the results come back positive or negative, we're not necessarily notified about these pieces. Dave is, and then they reach out to us to help them contact trace. So obviously with being full remote, it's not as extensive as it will be when students return, but that's the plan. Unless Dave, you want to speak to that a little bit more.
Yeah, I think it's important to remember, you know, obviously when they're remote, obviously that's because the only time there'd be an exposure inside the school is if they did an extracurricular activity where we might have to quarantine members of the team or something like that. But when you do come back, and we have had this in different school districts that have come back, we may quarantine a couple people in a classroom and you know, because again, there was, you know, we're not sure if they were exposed or not. And so it was close enough to quarantine them. And again, as long as we quarantine them, we pull them out of circulation, then we know it can't spread any further. And so again, so far, that hasn't really happened much throughout all the districts that are open. We've had a couple of kids quarantined, but then they don't necessarily come back positive. And so again, that's why we reach out so quickly to try to make sure we get a handle on it before it starts spreading.
And I think there's also, and I know that there's a lot of great things that come from HIPAA. It does get in the way a little bit in the pandemic, but we don't necessarily know who people are when they test positive. Our school nurse knows, and she handles it on that end because I'm not allowed to know, because I'm not part of that flow. Neither is most anyone else. It's a need to know basis, and Dave tells us the information we need to gather, and then those people know because we have to gather that information. But even the negative tests, and this actually surprised me, even if you test negative, that's protected by HIPAA. So we have to have steps in place to make sure that we are notifying parents, but in bulk and mass numbers without knowing who we're talking to. So that's what Katie explained, where they get notified by a robocall and they call in to find out the results.
And so there's this huge piece where the district is providing transparency for all of this. There's a COVID dashboard that's on the district website that is giving the running numbers through not only our testing efforts, but those who self-report, for instance, our staff members. But I think what our community thinks what that dashboard is doing is showing us, okay, once we get to this level, then no, we're not going to have in-person school as an option. Or as long as we remain under here, then it's safe to do so. Is that the real function of it? Is there is the intent for everybody to fully come back to school in person? You know, what should people be looking for? What should they anticipate?
I guess I'll start. I'm like Dave and Prakash to jump in. I think that in terms of the information, as we've said several times, our goal is to get information quickly to families if there's a positive case to make sure that when the child goes home, he can behave in a way that keeps his family member safe. We also want to make sure that what we're doing in school is if a student comes to school or an adult comes to school with it, no one else catches it because we're doing things correctly, and those things we measured. Now, if our positivity rate climbs, we're going to find out why. But back to my old answer, I'm going to do what I'm told. So if Dave says it's not safe, Jeff, then we'll make a decision. But that's not necessarily what this is ultimately designed for. But if it gives us that information, then obviously we'll react accordingly.
Yeah, so I will say the dashboard is important, communication is important, and what we found mostly in school districts is rumor mills are more difficult, and the worried well are more of a problem than the actual information. So I can't stress enough that it'll be important for the school district to make sure you get that information out, not just on the case numbers that, on the dashboard, but just in general, some general communication that'll need to come out periodically to kind of says where we are. That'll be really important. And then for parents to maybe not be the fueler of rumors and instead be the calming influence in families and in the district in general. Because again, we know with social media now, this information goes out and people guess at who might have it or who might not and all this other kind of stuff. And we've seen that in districts, and it's been painful for districts to go through it sometimes because, they may have 5 people on their website in the entire school district, and you may have 50 people claiming that they have it because they have some minor symptom and they've never been tested, but they say they have it. And so it can become a social media, mess, if you will. So the better and more transparent the school district can kind of get that information out to say, here's what we have going into school, the better you'll be in the end.
And I would just add what Dr. Graham stated. I think where we would come in is mostly looking at the why things are spreading, as he described it, and look at ways to effectively respond to that. And that would be coordinated with Dave and his team at Lorain County Public Health as well.
You're muted again.
Sorry. A final question that I have from our community is, assuming that a vaccine becomes available, let's say next spring, will we as a district, will the county, will that be a mandatory thing that we say you have to take this vaccine if you come back to school in person?
Well, you're going to hear a lot about vaccine. People may already know that earlier today, Pfizer mentioned that they're having a very effective vaccine. And so there are at least 4 or 5 different vaccines out there right now that are effective, being shown to be effective, and look like they're going to become safe and effective and probably approved in December. When that happens, most likely people working in medical communities and long-term care facilities will be the first group, and the high-risk folks will be the first group to get it. But then eventually, coming up here in early spring, you're going to see mass vaccination ability to be vaccinated. In terms of mandatory vaccine, so normally it takes a few years before any vaccine is considered a mandatory vaccine for schools. So it's unlikely that that'll come out immediately and it'll be mandatory vaccine. The big key is, though, the more people that get vaccinated and the more effective that vaccine is, the better we can snuff out this virus so that we can get back to at least more normal. And so that'll be an important piece. And you'll start to hear messages from me, from the director of health, from the CDC, from the governor, from all kinds of folks around vaccine and which vaccines are coming, how safe are they. It is unfortunate that they named it Operation Warp Speed. I would say that doesn't really give you a lot of warm and fuzzy feelings that it's being done properly and with enough safety. But I will say this: the FDA and these private companies that are developing next vaccine are very interested in making sure that it's effective and safe. And the reason is because they need it to be effective in order to snuff out this virus, and they need it to be safe because, again, a lot of the companies are worried they don't want to be sued, and the FDA wants to make sure everybody's safe. And so some of the technology was new technology when this first started, but most of the vaccines that are coming out that look like are going to be approved are already the same type of way that the vaccine works for flu or measles or any of these other vaccines. And so many of them are the same technology. There was some worry that if it's a brand new technology, are we really sure it'll be safe? So again, I think as you start to see this over the next few weeks, you're going to hear more and more about this. You're going to start figuring out how these vaccines are going to be distributed, how safe and how effective they are. And so that's all going to come out over the next, probably between now and Christmas. You're going to hear quite a bit about this. And again, the initial vaccines will be ready for first responders and for medical personnel, probably around Christmas and January, and then in more bulk ways in early spring. So that's the future of what's going to look like. I doubt that it'll be mandatory. However, it'll be highly recommended for folks.
Thank you for that. All right, we've been at it for about an hour here, a little bit over. Any final words from Health Department, from Case, from Mercy on like what's the main message that you want our families to take away right now? You know, here we are getting into November. What do you want them to know?
I could start. I think we just want to have I think Ross said it best earlier, was we just want to make sure that everybody is safe going back to school. And we know that we are doing everything we can to make sure that they're going back safely. I think that would be the main message or the main takeaway from this.
So I'll give the message that I've been giving quite a bit, and that is, we have a really high case count right now, and we know how to control this virus. We know that if you stay 6 feet apart and wash your hands and wear a mask, you can actually slow this virus down. And the light at the end of the tunnel is coming. In the early spring, we're going to really see some vaccination ability and some other things that are going to help us quite a bit. But the problem is we've got Thanksgiving and Christmas, all the holidays, and then we have the 3 hardest months. As someone who grew up in Northeast Ohio, the 3 hardest months, January, February, March, where it's cold. So please hang in there. We got 5 more months really, to really get through before we can really start to see an impact. So I know it's been a long marathon, I know, but we can make it. And again, as school reopens in Lorain, I think we can do it safely, and we can really, make sure that it's not causing a spread inside the community. So just hang in there a little longer.
Thank you, Dave. Katie?
I would just like to add that we're here for you if you need us. It is safe to seek care. Please reach out and let us know, and stay 6 feet apart, wear your mask, and wash your hands, please.
Well done. All right, so next steps. Parents will be receiving some information here shortly in preparation for phase 2, which is parent choice. Ross, you want to speak a little bit about what they should be looking for? And
yeah, the next 2 weeks, we're going to have a really important commitment survey coming out, and we're going to couple that with information about our mitigation practices. We'll show you a video of the schools. We hope that you have watched this video as well, so you have a clear picture of what we're going to be able to provide for your child. So please watch for that survey, and then it is extremely important for you to complete that survey. So that survey is going to be just the information we need to know exactly what we need to design based on who's coming back. So that should be coming up here in a couple of weeks. We also should be having a target date for a return to school here very soon. So within the next week or 2, we should have a target date as well. So you can start to put that on your calendar as well, coming up here very, very soon.
And a reminder that will not be, like, we wouldn't announce it on, say, a Tuesday with the expectation that next Monday is when we come back, right?
30 days. Yep. We've been clear about that all along. We're not wavering on that. So everybody will have at least 30 days before we return to in-person learning.
And again, the reason for the 30 days is so people have time to plan their lives. We know that right now everything is unpredictable, and daycare, and there's just so many things that kind of need to fall into place. And our goal is not to add more stress to your plate, but make sure that you have time to do things the right way.
All right. Thank you all so much for your participation in this discussion. Thank you to our viewers for checking in for this update. This video is going to be placed on the district website. It will be on our YouTube channel. It'll be pushed out through Facebook, through email, all the ways that we get information into your hands so that you can review this. Thanks so much, and we'll see you again soon.
If I could I just want to thank everybody one more time, and I try to do this as often as I can, especially in public. I want to thank everybody personally, as well as the organizations you represent. This is an awful time, and it's a crazy time, and it's an incredibly busy time. And for all of you to be willing to put one more thing on your plate to make sure that the children and families of Lorain are safe, I just can't thank you enough. So very much appreciated.
Awesome. Thank you. All right.